Hi friends, today we are going to discuss telemedicine practice guidelines for Ayush doctors. Myself, Dr. Suresh Bada, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Services at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. Whatever presentation I am going to do is more of academic purpose only. If you would like to have any legal opinion, please do contact an advocate. I also request you kindly go through the original document of Telemedicine Practice Guideline released by Ayush. Background. See, we have reached planet Mars, but we are unable to reach our own rural population with regard to health services. There are many reasons, but with regard to technology, there are few important points I would like to mention here. Doctors have been very apprehensive to use telemedicine technology for the purpose of providing services. At the same time, there are many councils and the High Court decisions which have told that not to use this technology. In this background, this technology of telemedicine did not take it very fast. However, in the background of coronavirus infection, where the doctor also has to be safe and also the patient who is coming to the hospital has to be safe. In this background, telemedicine guidelines was drafted. This is a most welcome and a long-awaited guideline. This telemedicine guidelines is for Ayush doctors. It was ratified by Indian Medicine Central Council Act of 1970. So what is the validity of this guideline? Is it legally valid document? Of course, this guideline is a legally valid document. In India, the Ayush practice has been governed by Indian Medicine Central Council Act of 1970. Under this legislation only, these guidelines have been drafted and notified. Do this guideline discusses comprehensively about the telemedicine setup in India for Ayush doctors? This guideline specifically explicitly excludes hardware, software, maintenance, infrastructure, building. At the same time, this guideline do not discuss about the data storage, data management, standard, interoperability. Those issues have not been discussed. At the same time, this guideline also do not discuss about digital technology used for any invasive procedure. And also, it excludes research, evaluation, or else any telehealth education for health workers have been excluded. Further, this guideline does not discuss about providing telemedicine consultation outside the jurisdiction of India. Further, this technology cannot be used for certain procedures like Panchakarma procedures like Vaman, Virachana, Basti, Raktamoshana. Similar kind of procedures are not allowed to use telemedicine technology. That means telemedicine technology for Ayush doctor does not discuss many of this. Who can provide telemedicine consultation under this guidelines? Ayush doctors. Who are these Ayush doctors? Ayush doctors is an RMP defined as a person who is enrolled in the State Medical Register of Indian Medicine or the Central Register of Indian Medicine under the Indian Medicine Central Council Act of 1970. What are the prerequisites for RMP to undertake the teleconsultation? These are the prerequisites. Those guidelines should be in conjunction with the other national clinical standards, protocols, policies, procedures which are applicable in tradition in-person consultation. Same thing is applicable in telemedicine consultation. Basically the laws, the procedures which are applicable in person, same thing is applicable in telemedicine. Along with this, before a person, that Ayush doctor, before he goes for telemedicine, he needs to undergo an online course, which is mandatory, which he has to finish within 3 years of notifying that course. Currently, the Ayush, this course has not been notified. During this interim period, the following guidelines has to be followed, whatever which have been ratified. The qualifying course may be notified shortly. Under extraordinary situation like in COVID-19, the state government and the central government come up with a notification which can say telemedicine guidelines can be used by the RMPs of Ayush. For example, if it has to be more than 1 month, then central notification is required, basically from the central government. That's what the guideline clearly says. What are the ethical and legal standards of telemedicine consultation? There are various important points, but let us focus on three important criteria which is required that should be kept in mind by the Ayush doctor. First and the foremost, same ethical standard is applicable, which is applicable in real consultation, what we call it as in-person consultation, same thing is applicable. Same laws which are applicable in-person consultation, or what we call it as face-to-face real consultation, same thing is applicable even in telemedicine consultation. Further, they also need to follow Indian Medicine Central Council Act and this guideline. The guideline is Telemedicine Practice Guideline for Ayush doctors. Can I provide telemedicine consultation to a patient residing in any other state? For example, if I am residing in Karnataka, can I provide a service to a patient in Tamil Nadu? Of course, the 1.3.1, the guideline clearly says a RMP is entitled to provide telemedicine consultation to patients from any part of India. Although you have been given license to practice and provide services to any patient in any part of the country, however, you need to know one important point. You should know the state laws, what medicines can be given, what medicines cannot be given in that specific state. This is very specific for Ayush. What are the guiding principles of telemedicine consultation? There are very important essential telemedicine principles are there. First and the foremost, to the patient. The patient has a right to discontinue telemedicine consultation at any stage during any session. The patient say, I don't want telemedicine consultation. I would like to come and meet you in person. That is very essential for the patient. At the same time, the doctor also has been given certain important essential guidelines. They are telemedicine consultation will be treated similar to in-person consultation with regard to ethics and law. That is essential. Second, the professional judgment of an RMP shall be the guiding principle of telemedicine consultation. Again, I will repeat, professional judgment of an RMP in Ayush, whatever his judgment with regard to profession will be the guiding principle. RMP can choose not to proceed with telemedicine consultation at any time and at any stage. RMP has the discretion to decide the method and mode. Method and mode, he can ask for in-person, he can ask for just a text, that is email or messaging, or else he may ask for video or audio call or a digital consultation. It is the discretion of the even RMP to decide which mode. Can either of the party can be anonymous during the telemedicine consultation? No. The telemedicine consultation do not give any kind of permission for this kind of anonymous consultation. Both the parties need to identify each other. The doctor, basically Ayush doctor, need to verify the ID of the patient. He need to ask for photo ID. For example, it may be Aadhaar, it may be DL, or it may be any PAN card where the photo ID, government photo ID is used. At the same time, Ayush doctor also need to identify himself and also tell his introduction to the patient before he starts telemedicine consultation. He has to say, I am so and so, I am practicing Ayush, this is my registration number and this is my address and this is my contact address. This has to be done. Without that, the anonymous consultation is not allowed under telemedicine. What are the different methods and mode of telemedicine consultations are allowed? Text, that is messaging, email on any platform is allowed, images, sending photos, receiving CT scan allowed, audio, making phone calls, video calls, digital data connected with devices. So ECG machine and sending the data. All these are a mixed method. Any of them can be, like the patient will make a phone call and then it will be a video call. And RMP has the discretion to choose which method and what time which method to be applied. It is the discretion of the RMP. No media have been prohibited under this guideline. Even the social media has not been prohibited. That means this telemedicine has allowed WhatsApp, Facebook, any of those medias can be used. It has not prohibited. The main reason being is This whatever application software should be easily available for the patient, and it is easy to use. That's what the guiding principle of this whole telemedicine guidelines. Who can initiate the telemedicine consultation? Consultation framework. Patient to Ayush doctor, caregiver to Ayush doctor, one Ayush doctor to another Ayush doctor or a specialist, healthcare worker to Ayush doctor. So these are the four important consultation framework has been defined. Along with this, there are two different types of consultation has been also chosen. First consultation, follow-up consultation. Again, I would like to re-emphasize, RMP has the discretion to decide the mode of teleconsultation. It may be in person, it may be text, it may be audio, it may be video, or combination of this. So consultation framework has been made very easy and patient friendly in this guideline. What is the process of initiation of telemedicine consultation? The patient makes a contact with the Ayush doctor either by texting, maybe SMS, messaging, or an email, or else a phone call, or else a video call. As soon as he makes this contact, it is considered as an implied consent. Once the consent has been considered as implied, now the Ayush doctor has to identify the patient. How he is going to identify? He is going to ask for a government ID like Aadhaar card, PAN card. That identification is essential. Once the identification is done, the doctor has to do an immediate quick assessment for emergency care requirement. If there is an emergency care requirement is there, immediately the patient will be advised for first aid and appropriate referral will be done. If there is no emergency care is there required, immediately will be asked for detailed evaluation. So what is the detailed evaluation? The doctor will ask for more information, history, clinical history, family history, personal history. Those information will be collected. If the Ayush doctor feels no, this patient requires in-person consultation or a physical examination, he will immediately refer to them. If he thinks there is investigation is required, he will give investigation list to the patient, and then telemedicine is paused. He will be called after 3 or 4 days with the investigation to continue the telemedicine consultation. At the same time, the RMP, Ayush doctor needs to keep all those records. That is very, very essential. In this process, if the RMP is unable to make any diagnosis or even a provisional diagnosis, the RMP is in the liberty to ask for the patient to come for in-person consultation. Just now we discussed about implied consent. When should the Ayush doctor should take explicit consent? What is the format of explicit consent? Explicit consent means taking consent apart from implied consent. A healthcare worker, an RMP or a caregiver initiates the telemedicine consultation apart from the patient. Explicit consent is required. A explicit consent can be either recorded in a form of pen and paper, which is common, or an email or a message, audio message, video message. Any of these will be considered as a format approved by the telemedicine guideline for the explicit consent. The content can be, yes, the patient will say, yes, I consent to avail consultation via telemedicine. This needs to be recorded and kept with the patient file. What to do? Patient has called me in an emergency consultation. Immediately he has called, I am going through some emergency situation. What should the Ayush doctor should do? In emergency situation, Ayush doctor should exercise his professional judgment to decide whether telemedicine consultation is appropriate in a given situation or an in-person consultation is required. It is the professional discretion has to be done. However, there is an obligation has been casted upon the Ayush doctor. That means in all cases of emergency situation, the patient must be advised for in-person consultation with an RMP at the earliest. And before he does it, he needs to give advice for first aid, counseling, and he has to facilitate the referral. So my dear Ayush doctors, please do understand, in all cases of emergency, ask for in-person consultation or give an appropriate referral. Don't engage the patient for longer duration. Please do give advice on first aid, counseling, facilitate referral. What to do? Patient has initiated a telemedicine consultation for the first time. First consult as per this guideline means for the first time patient is consulting over telemedicine consultation with the Ayush doctor, or else the patient has consulted the Ayush doctor more than 6 months back. Then also it is considered as first consult, or else the patient has recently had seen the Ayush doctor around 3 months back, but now he is coming with a different health condition. Earlier he had come for headache, now he has come with a fracture. So there are two different health conditions, though it may be 2 months apart, it is considered as a first consult. Both are considered as a first consult. The procedure is same. Patient initiates the telemedicine consultation by sending a message or an email, or else a phone call or a video call. As soon as he does, it is considered as implied consent. Once he does that, the doctor will make a phone call or he will ask for an audio or a video consultation, and he will identify the patient. You will ask him to provide an ID. Once the ID is given and the age proof is given, the doctor will make a immediate quick emergency assessment. If there is an emergency care is required, first aid is advised and he is referred. If there is no emergency care is required, a detailed assessment will be carried out. During the detailed assessment, if the doctor feels that no, he requires emergency care, again he will be referred. If there is no emergency care is required, the continuation occurs. The management of the first consult will start with health education, counseling, and a specific treatment is given. However, if you had to prescribe a medicine, video consultation is a must. That's what this telemedicine guideline says. That means to prescribe a medicine, video consultation is required. However, audio or email, specific treatment, health education, counseling is possible. But for prescribing a medicine, video consultation is required for the first consult. What to do? My old patient has initiated a telemedicine consultation. Follow-up consultation means patient is consulting the Ayush doctor within 6 months of in-person consultation. In-person is very, very essential. Then only follow-up under telemedicine is allowed. However, if he is continuously contacting over telemedicine, first consult is also telemedicine, next consultation is also considered as first consultation. To be a follow-up consultation, it has to be in person first. Please do understand that. However, certain exclusion is very essential. If the Ayush doctor does not remember him of in-person consultation, then also it is considered as first consult. Along with this, if the patient had contacted the Ayush doctor for some other health condition around 3 months back, but now he is consulting for a new symptoms, still it is considered as first consult, not a follow-up consult. Again, the procedure is same. Patient makes a contact with the Ayush doctor either by a text, that is email or message, or else audio call or a video call. Consent is considered as implied. The doctor will make him for identification. He may ask for the photo ID card or the doctor's own prescription, because since it is a follow-up, or else during registration, what email ID, what phone number has been taken. Here the doctor has to know he is talking to the same patient whom he had seen recently. That is very essential. Once the doctor has made sure he is talking to the same person, you will go ahead with the assessment. If there is an emergency care is required, then he will be referred appropriately. If there is no emergency care is required, then the detailed assessment will take place. During this detailed assessment and management, health education is done, counseling is done, refilling of the medicines. Whatever he has seen in person, same refill can do, or else add-on medicine. There may be another add-on medicine or augmentation can be done. If the patient has come with a new complaint, then it is considered as a new consult. Can a caregiver initiate a telemedicine consultation? Yes, caregiver can contact the Ayush doctor. Caregiver is a family member or any person authorized by the patient to represent is considered as a caregiver. There are two situations in this. Patient and caregiver both are present, or else only caregiver is present and the patient is not there. Only caregiver is allowed when the patient is child, that is less than 18 years, or patient is incapacitated like dementia or severe mental disorder. And a formal authorization letter is required from the patient regarding the in-person of the caregiver or telemedicine consultation. Along with this, the doctor should establish a relationship that this person is so and so, or else the RMP had seen him in person around 2 or 3 months back and he is able to recognize him over the telemedicine along with the authorization letter. That is very essential. Then the caregiver can consult, and it may be first consult or it may be follow-up consult. Can a healthcare worker initiate a telemedicine consultation? Of course, healthcare worker can do, but however, here you should understand what is healthcare worker. A nurse, a allied health professional, mid-level healthcare worker, ANM, or any health worker who have been designated by the appropriate authority is considered as a healthcare worker. This initiating of the telemedicine consultation can occur from any health establishment, health camp, home visit, mobile medical unit, or any community-based intervention or interaction. This initiation can take place. However, the healthcare worker can contact either a public or a private establishment. However, further, health worker need to take consent and identify the patient. This informed consent has to be explicit. Once the patient has given consent and he has identified him, the healthcare worker contacts the RMP. Once the RMP knows the health worker has contacted for a particular patient, then now the RMP need to identify the patient. Again, consent has to be taken to go ahead with the telemedicine consultation. Can RMP initiate a teleconsultation with another RMP? Basically, one Ayush doctor asking for another Ayush doctor, or else for a specialist. Yes, Ayush doctor can initiate a telemedicine consultation with another Ayush or a specialist. Again here, the Ayush doctor need to take explicit consent from the patient. Along with that, the RMP who is initiating the consultation will be considered as a primary responsibility for providing clinical care. That is very essential. So, a Ayush doctor can ask for a specialist opinion or else from another Ayush doctor for any opinion. Can a RMP prescribe any medication on telemedicine consultation? Of course, RMP has been empowered to prescribe medicine online, and also whatever ethical, legal and same professional accountability which is there in traditional in-person consultation, same is applicable even in telemedicine consultation. If a medical condition requires particular SOPs, protocols, guidelines to be followed, same thing will be applicable even in telemedicine consultation. Further, Ayush doctors are well known to make tailor-made formulation. So, personal formulation of mixing some ingredients along with the other is allowed under telemedicine of Ayush. However, it is mandatory for Ayush doctor to disclose all those ingredients and such formulation to the patient. This is a very important criteria. Further, manufacturing and right to prescribe medicines are governed by state acts. Certain acts like certain medications of Ayush which are prepared in Kerala may not be the same in Tamil Nadu. At the same time, certain medicines have been prohibited in certain states. That means a Kerala doctor, Ayush doctor can prescribe a patient who is sitting in Maharashtra, but he need to follow the guidelines or the state law of Maharashtra. That's what it essentially says. You can practice across India, but you need to follow the state rules where the patient is residing. RMP may prescribe medicine via telemedicine only when RMP is satisfied that he has gathered adequate relevant information about the patient medical condition. Without having adequate information, please don't prescribe medicine. If tomorrow you have prescribed medicine and you say telemedicine consultation has its own limitation, it is not allowed. You have to reach a provisional diagnosis. At the same time, you also should have gathered adequate information to reach that provisional diagnosis. And the prescribing medicine should be in the interest of the patient. That is a very essential criteria. But however, there are some prohibited lists. Vishadravyas, that is basically poisonous substances, are prohibited. The drugs listed under narcotic and psychotropic substances have been prohibited. For example, you cannot prescribe morphine, pethidine, codeine, cannabis. Benzodiazepines are prohibited. You cannot prescribe on telemedicine either in the first consultation or in the follow-up. They are prohibited. Please don't prescribe these medicines. And very essential, again I'm repeating this, prescribing medicine without an appropriate diagnosis or a provisional diagnosis is considered as misconduct. How to send the prescription and format of prescription. As per the practitioners of Indian medicine, Standard Professional Conduct Etiquette and Code of Ethics Regulation of 1982, same will be applicable in telemedicine consultation. Along with this, photo of the prescription, scanned copy of the prescription, digital copy of the prescription can be sent via email or by any messaging platform. Even e-prescription can be sent. E-prescription is basically using a software where the doctor's identity is very clearly done and the doctor can send it to a pharmacy. However, you need to take explicit consent from the patient that he is sending to a pharmacy and the patient has given consent for that. That is very essential. Then only the Ayush doctor can send it to a particular pharmacy using an application or even without application, but he has to take explicit consent. What constitutes misconduct during teleconsultation? As per the practitioners of Indian medicine, Standard Professional Conduct Etiquette and Code of Ethics Regulation of 1982, whatever they are enlisted there, same thing applicable in telemedicine consultation. And Ayush doctor insisting for telemedicine only when the patient says, I can come and meet you, but doctor says, no, you have to come on telemedicine. That is considered as professional misconduct. Misusing the patient's images and data without explicit consent is very essential. And at the same time, Ayush doctor prescribing prohibited medicine is considered as misconduct. At the same time, if the RMP or the Ayush doctor soliciting patient over social media or any form of advertisement is considered as misconduct. The penalties are basically the same as Indian Medicine Center Council Act. Whatever the ethics regulation is, prevailing laws are there. Whatever the penalties listed there, same will be applicable even for telemedicine consultation. What records to be kept in telemedicine consultation? This is a big question for many of these Ayush doctors. What should I do? What record should be kept? Again, whatever you are going to record in person, same record you will keep either digitally or non-digitally. That means if a patient comes to my OPD, whatever documentation I am going to do either in the prescription or maybe a logbook, that you are going to do. Along with that, the log of the call, log of the email, phone logs, email, text record, video record, logs will be kept. Not the complete video record, audio record, the log. What is log? Basically the phone number so-and-so, Mr. So-and-so called me at this time with this phone number. That is what we call it as video log or audio log. Patient records, reports, documents, images, diagnostic data, either in the digital format or in the physical format, utilized during the telemedicine consultation should be retained by the doctor. So very specific, you have to keep all those data. Along with this, if the Ayush doctor has given a prescription, a copy of the prescription has to be retained by the Ayush doctor. So these are the records. So that means telemedicine consultation doesn't say that you are not supposed to use physical records or only you have to use EHR, that is electronic health record or electronic medical record. Both you can keep or else you can choose one of them. I would prefer to consider as a physical record. Patient has come on WhatsApp or maybe video consultation. I will record it either in the prescription format and one physical format. I'll keep it. Another one I will take a photocopy or a photo and I will transmit to the patient. So the whole recording will be considered as a medical records. What about confidentiality and privacy of the data? What happens if the data get leaked? What happens if the server is hacked? Again, same principle, medical ethics, professional accountability, which have been mentioned in the Indian Medicine Central Council Act of 1970, same thing is applicable, which occurs in person. Same thing is applicable even in telemedicine consultation. Further, RMP shall be abided by the practitioner of Indian Medicine Regulation of 1982 with relevant IT Act, data protection and privacy laws. Any other laws which are coming with regard to IT will be applicable. If there is a hack, see, there is a master stroke. If you ask me, very beautifully they have written about this 3.8.13. What does it say? The Ayush doctor will not be held responsible for breach of confidentiality if there is a reasonable evidence to believe that the patient's privacy and confidentiality has been compromised by technology breach or by a third person other than RMP. That means if there is a hack, if there is somebody else has accessed without the RMP, then RMP will not be held responsible. So this is one of the beautiful clause for confidentiality, and the Ayush doctor will not be held responsible if there is hacking or a technology breach or somebody else uses or the patient leaks the data. So RMP will not be held responsible. But however, RMP should ensure the reasonable degree of care undertaken during hiring such services. So these are the important confidentiality clause which are mentioned under the guidelines. Can we charge fee for the telemedicine consultation? Of course. Whatever you are going to charge in-person consultation, same thing will be applicable in telemedicine consultation. Appropriate fee for the telemedicine consultation can also be done, but however, you are going to give receipt, invoice for telemedicine consultation. That is very essential. What is the role and responsibility of technology platforms? What we call it as aggregators or intermediaries or online platforms. Basically a software industry like Practos or what we call it as like Uber model, where there is a driver and commuters. Similarly, there are doctors, there are patients here, and the software providing industry, that is called as intermediaries or aggregators. What is their role and responsibilities? These aggregators or a software company need to enroll only Ayush doctors for this telemedicine practice guideline under for Ayush. Qualification of these Ayush doctors' contact details have to be displayed, and there should be a grievance mechanism should be in place. Artificial intelligence should be prohibited for consulting and prescribing medicine. If they violate any laws, these aggregators or what we call it as intermediaries or software companies, if they violate any law, this council, Ayush council, can blacklist them and can say all the Ayush doctor not to use these softwares. That's a beautiful clause which has been clearly written. Now coming to the last part of my presentation, how to avoid medico-legal issues online. First and the foremost, before you initiate the telemedicine consultation, Ayush doctor needs to identify the patient by using government authorized ID. And when the consultation starts, check whether there is an emergency care is required. If the emergency care is required, please do appropriate referral. Before you prescribe a medicine, at least do provisional diagnosis and do not prescribe medicines which have been prohibited, that is Vishadravya and drugs listed under NDPS. At the same time, you also should know if you are prescribing a medicine for a patient from another state, what are the state laws regarding that medication you should know. You should not say that I am sitting in Karnataka and the patient is from Kerala, I did not know the law. If you are going to prescribe medications for a patient from another state, the local laws you should know. That's very clearly mentioned in this. Further, when you prescribe medicines, please retain the copy of it along with other medical records. Do not share the patient's data with anyone. Whatever ethical and legal issues which are applicable in-person consultation, same thing is applicable even in telemedicine consultation. Coming to the critique of this guideline, the positive aspects. This telemedicine guideline for Ayush doctor is patient friendly, simple but comprehensive, and it is the patient can say, I do not want to use telemedicine consultation anytime at any stage, and he may ask for in-person consultation. Similarly, a Ayush doctor can say, you don't require telemedicine consultation, you need to come for in-person consultation anytime. That means there is a freedom on both the side. anybody can withdraw from telling that you need to have in-person consultation. So that clinical freedom and the patient freedom is also given, and no digital format has been banned. Text, audio, video, digital, all are allowed, and it has not banned any social media. The reason being is when Niti Aayog and also the board of directors, when they went for drafting, they said it should be patient centric. It is easy to name a comprehensive softwares which is very difficult to be used by a doctor and a patient. No, this telemedicine has to reach for the rural patient. For that reason, you need to have a software and hardware which is easily usable by a patient who is in rural area. The telemedicine guideline is written for the rural patient, and it is written for the patient, not for doctors. For the doctors, it is facilitating. So please don't use a comprehensive software and hardware which you cannot get trained and which even the patient cannot use it. So please don't again make this telemedicine only for urban patient. It has to be patient friendly, and the patient should use those software very easily, like WhatsApp. You can do a video consultation on WhatsApp and the patient is happy with that. Why not? If the patient is using Facebook and you are able to do a consultation, why not? It is patient friendly. And if you ask me, I have done the review of many telemedicine guidelines across the world. This is one of the best and the patient friendly. And let me remind you one more thing. US has talked about HIPAA compliance, but during coronavirus infection, they have removed that HIPAA compliance. So that means the compliance has been made very simple, because it has to be patient centric, not doctor centric software and hardware. So please use very simple software and hardware. And this guideline is going to be a paradigm shift, the way we are going to practice our medicine. It's going to be a game changer. In few years, you will be seeing many of the patients asking for telemedicine consultation before they come for in-person consultation. So please do adopt and help our patients who are in the rural area. But however, though this telemedicine guideline is very wonderful, but there are some drawbacks. What are those drawbacks? Rather than drawbacks, I would like to tell them as silent. If the patient releases doctor's audio video, will they be held responsible that they are silent? If the patient wants to give a complaint against a doctor who is practicing in another state, where should he give complaint? In the patient residing state or in the doctor's practicing state? Insurance for telemedicine consultation is still not been discussed. Aggregators, basically the software industry, who is the owner of the data, whatever the data which comes there. Along with these, online platforms do rating of the doctors, whether should be allowed or not, or else they may even fetch the data. If the doctor gives too huge amount of money, they may say he is an excellent doctor and all reviews may be written. So what will happen to that kind of thing? In a clinical establishment act in a state, for example, Karnataka has Karnataka Private Establishment Act. Whether this telemedicine practice is applicable, if it is applicable, imagine if a doctor, Ayush doctor from Kerala, how will he practice here without getting registered under KPMA Act in Karnataka? So these are the certain drawbacks. To conclude, since there is a coronavirus infection, COVID, this is the time now to change. And to change, you are the person who is going to make the initiation to help our patient. And the telemedicine is the solution to foster the right to healthcare at home. Thank you very much.